So I'm going to ask this to any of you to raise your hand or this or unmute yourself and answer. The following are the things to do for a preterm, except the ambient room temperature has to be increased prior to delivery. Baby has to be wrapped in a polythene wrap. Sorry. Can you go back? Immediately after delivery, the head need not be covered. Infant's temperature needs to be monitored. Baby needs to be thoroughly scrubbed and dried with a dry towel. So can you go back, Ma? I'll tell you as a problem.
Yes, sir, sorry.
So can anybody answer the question here, please?
It's the E. Baby need to be thoroughly scrubbed and dried with a dry towel.
So Momita, you can just put your video on and tell me, why do you think baby, you mean to say the baby should be scrubbed or should not be scrubbed?
Should not be scrubbed, sir.
Yes. So that's a good answer. And is there anything else in this which you think? These questions may have double answers also or triple answers also. What else?
Sir, head need not to be covered. See.
Okay. So that's again important.
Head should be dried but need not to be covered.
Yes. In a way, you're right, Dr. Anand. Welcome. Such a senior member of the community, neonatal community has joined us. Thank you. But what happens in a preterm, what the fundamental principle in the preterm is lying inside the amniotic fluid in a temperature of 37 degrees, which is already the mother's body warm. So when you get the baby out and you scrub the baby, you're actually making the baby cold. Baby just needs to be immediately, without really washing off the baby's skin or removing the fluid, you try to cover the baby with a polythene wrap. For the head also, you can dry it up a little bit and cover it with a polythene wrap, or preferably you can even use a cap. Any woolen cap is also fine. Of course, we are obviously going to keep the child kept under a warm incubator or in a warmer or something like that. So, I think this would be, next slide please, Jyoti. So this is basically just to show you that if you prevent the temperature from reducing by 1 degree centigrade, you are reducing the mortality itself by 50%. That's so significant a statement. Just listen. Remember, we discussed this earlier also in the module. 1 degree centigrade if the temperature comes down, especially if it's a less than 38 weeker, the mortality of the child is likely to become double. So we try to make sure the temperature of the environment, which should be at least 26 degrees centigrade, the baby's temperature care soon after birth should be well monitored. So all these 5 points which we have told you have to be looked into when the baby is going to be delivered.